Hey guys, this is Dr. Hub. Today we are looking at the column theory of the spine. So first we need to know that the column of the spine, there are three varieties, that is A for the anterior. So in terms of the anterior longitudinal ligament, so it involves the anterior longitudinal ligament. Next, it also includes the anterior annulus. So anterior annulus. Next is there is involvement of the anterior two-third of the vertebral body. So this anterior two-third of the WB, that is the VB, that is the vertebral body, is also present in the anterior. Now as we move along, next is what we have is the middle. So in terms of the middle column, it involves the posterior one-third. So in anterior it was anterior two-third, and here it is posterior one-third. So posterior one-third is of the VB, that is the vertebral body. Next we have the posterior annulus. So posterior annulus. Then comes the posterior longitudinal ligament. So it is a posterior longitudinal ligament. Next what we have in line is the posterior column. So in posterior column, it is the posterior elements. So what do you mean by posterior elements? So under posterior elements, it includes the pedicels. So there is presence of the pedicels. There is the facets. There is presence of the lamina, as well as there is the spinous process which is associated. And along with this, there is also the presence of the posterior ligaments. So this column theory of this vertebral fractures, this was put by Dennis. It was put by Dennis. So in terms of the anterior column, as we discussed, it is composed of the anterior two-third. So it is composed of the anterior two-third of the vertebral body and the anterior part of the intervertebral disc, as well as the anterior longitudinal ligament. Now when we spoke about the middle we had the posterior one-third. So it was the posterior one-third of the vertebral body. Next, the posterior part of the intervertebral disc, as well as the posterior longitudinal ligament. Now when we spoke about the posterior, it consists of the pedicels. So pedicels, then we also saw the facet joints. So there was also the facet joints. Next was the posterior bony arch. There was presence of the posterior bony arch, as well as there is a interspinatus and supraspinatus ligament. So it is interspinatus as well as a supraspinatus ligaments. So all fractures, they involve the middle column. So mainly the fractures, it involves the middle column. So it involves the middle column and at least one of the other columns, and which involve at least one other column. So at least one other column. So this is regarded as unstable. So if such a scenario, it means that it is unstable. To learn and grow daily like this, please do subscribe.